Well, obviously, GBS is very excited to have a partner with ACI and GBMC to have a great healthcare delivery system. GBS paying the claims and ACI to connect all those dots so we can provide the best possible care to the members and our clients. Now, GBMC delivers healthcare, and I see that there's a lot of brokers and consultants in the room. And that's what I'm going to talk about today is how we're going to pay for this. It's a great system, and we're going to make a difference in bending the curve on the rising costs of healthcare. So at the end of the day, how are we going to pay for it a better way? So the delivery system is a better way, the connectivity through ACI is a better way, having the doctors have all that information at their fingertips. They'll know more about the patient before the patient even walks through the door. So this is great information. This slide right here is something that's not new. It's really talking about the rising cost of healthcare. It continues to rise. It's no surprise to anybody. While some delivery systems are managing the care better, but the healthcare at large, the prices are still going up and the cost continues to rise. Why employers need Habio is for all these reasons here that we already know. Many businesses pay more for the insurance than they need. In the fully insured world, because I'm going to talk about self-funding, in the fully insured world, you're paying that fully insured premium. So whether you're using that much in healthcare expenses or not, you're paying the full premium out whether you're using it or not. So in most cases, you're overpaying for your premium. Additional expenses incurred due to the ACA requirements, so that's adding more cost to the system. So the cost continues to rise. So it's a challenge for employers to keep meeting their budget needs when the cost continues to rise. So they're looking for a better way to pay for this. And then difficult accessing information. For those consultants that are in the room, when you're delivering the renewals, the information, the claims experience is starting to go away. On that mid-sized market, we're getting less and less information to do a good job in shopping the marketplace for our employer groups. So the challenges are getting greater as the information is going away. Well, through the Habio system, we're increasing the information that employers can get to make good, educated decisions on what they should do. So that's kind of the challenges that are happening as time marches on. So the good news is that we're providing these type solutions that bring back the information and the funding arrangements that's going to help people save money. And the lack of employee engagement. Unless you really have a strong wellness and population health management engagement process, then you don't have everybody in the game. And we're connecting all the dots from the delivery system to the TPA and the technology. But at the end of the day, we need all the employees and their spouses engaged in this process to make a difference. And then when you provide them with the technology and the incentives to do so, they will. So this is the perfect storm all coming together to create the best delivery system in the most cost-effective manner and giving all the information to everyone needed to deliver this. The target market groups for the size, right now the 20 to 300 is the real sweet spot with this type product. Now we can go above that number, but right now when I get to the end, I'm going to show you the Habio website where you can actually go get a quote. And based on that, that's the real sweet market right now, sweet spot, because most of those type groups right now are fully insured. And they're trying to figure out a better way, a cost-effective way of paying for this and still getting information to their employees and to their self to make good educated decisions. So that 20 to 300 employee is the sweet spot. And then, of course, you saw the geographical map that everyone has. There is a geographics to the best possible model where your employer groups might be sitting to get the most out of the network. So that type of delivery system. So we're going to compare fully insured to self-funded, and you can actually do the healthcare interactive wellness programs. Even on the fully insured side, you don't get the same type of integration with data. But again, I know ACI, they'll do it fully insured or self-funded. Just self-funded, GBS will share that claims data to actually improve the outcomes and the information is shared for the delivery system. Employers are still getting the double digits increases, so their tolerance to look outside the box. I know in the fully insured world, we're always showing, I think we're down to 5 carriers now or less. And so you're always looking at raising deductibles or co-payments to get the cost down, or even taking more out of the employee's pay, the cost share, and that's always a big favorite amongst employees. And HR people that have to deliver that information. So the tolerance for just the same old is getting unbearable. So getting employers to look outside the box right now is easier than ever. because of the cost and to continue the double-digit increases. The interest in wellness and value-driven plan designs, an employer must have that feeling of where they want to make a difference, where they want to get out of the box. So we're looking for employers that have this feeling of getting out of the box, wanting to make a difference, getting their employees engaged. So when you're talking to your employer clients, you want to have a meaningful conversation to make sure that when you bring this type of product to the table, they understand the concept and they want this type of information. So when you're talking and qualifying your prospects, you want to make sure that they understand that. And of course, in the self-funded world, they get the opportunity to share in the savings. So when you're self-funded and you're not having a bad year, and every once in a while employees are going to have bad years, it's just the way things happen, and you might pay the same as fully insured, but on all those good years where everybody doesn't have catastrophic expenses, the employer is going to save money. And at the end of the day, self-funding, as far as financing your healthcare expenses, that's what it's all about. And then once you start including some of the programs that we're talking about, you will begin to bend that curve on the rising cost of healthcare. So the savings are going to go up. So the financial benefits, when you look at the way fully insured is compared to the self-funding, you can see the components on the bar chart over there. And as soon as you self-fund, you get the advantages of not having some of the state taxes. So you're going to have some of those expenses that are built into premium, because you slide down the premium when you're stop loss, because you're going to lower your fixed cost. So that's where all the fat is built into a lot of the expenses in the fully insured world. So you're basically going to lower the premium. So you're squeezing out the fat and some of the costs right out of the gate before you even get the claims. Right away, you're going to start saving money. The effective cost containment between the PCP and the patient-centered medical home, you're going to save money there. So the population risk management. So once you build all these things into the self-funded program, you're immediately going to start to get return on your investment. The reason why I like to show this slide is because that red bar is your fully insured premium, and then the right bar is the same kind of slide where it shows the blue is the administrative fees, the stop loss is the premium when you're buying to protect you against catastrophic expenses, and then the green is the cash fund, the claims fund that you're going to use to pay for expected claims. Now what's interesting about this is what most people, especially if you're in that 200 to 300 market, if you're fully insured as an employer, you don't understand. If you're fully insured, when you pay your premium into the carrier, they're doing the same thing that we're doing behind the scenes. When you pay your premium into the fully insured carrier, they're going to take out for administrative fees. They buy reinsurance on your company, and then by law, they have to put money in reserves to pay for expected claim. I don't care if you're health insurance or life or disability insurance company, by law, you have to put reserves away. So in those reserves is where most of their profit is. So what we do in the level funded, self-funded plan, we build it exactly like that with one big difference. Who owns the reserves? So in our self-funded level funded plan, the employer owns the reserves. So when they have their good years and they don't use all the surplus money, they get the benefit of getting that money back. That's really, when you look at level funded versus fully insured, we build it behind the scenes the same way as the fully insured carriers do, with the advantage of earning the surplus money. And most employers, when you explain it to them that way, they have no idea what happens to that premium when it goes to the insurance company. All they know is they get an increase next year, and with the limited information they're getting, that sometimes they don't even know how much of the surplus they've used, so they're not getting that information. So by going to a level funded type plan, they will have access to the data. If they're getting an increase, they know why. So it's important to have that information when we're, as consultants, delivering the information. Why self-funded works? Statistically, we pay a lot of claims to a lot of companies, and these statistics hold true for almost every single company. The majority of your population of employees and their dependents are not going to have catastrophic expenses. Statistically, about 67% won't even get through $500. They're the healthy folks that have an occasional office visit and prescription. 93% won't even get past $2,500. And insurance companies aren't worried about those folks. What they're worried about is the catastrophic expenses. 5 to 10% of your population will have the odds of having a catastrophic expense. That's why you have stop loss insurance, to protect you against the catastrophic expenses that you can't afford. That's why you have insurance. So at the end of the day, you're buying insurance to protect you against the 7% of your population and just pay for the smaller incidental expenses. So that's why self-funded, that funding mechanism for paying for healthcare expenses, works. Here's a little example we always do, because we'll talk to companies from year to year, and usually when you introduce self-funding to a company for the first time, they may or may not do it. It's a different animal. It may take a couple years for them to grasp a new concept and actually realize that it makes sense to do this. And all this does, we do each year, we'll do a history. On the column right here, on their fully insured column, it says what their premium was and what their claims were. There's 120 employees. So what we do is we'll do the claims, or we'll do the analysis where we have the stop loss or the fixed cost, and then we add the claims into that, and then next year when we come back around, we'll show them what they would have saved. In this case, it's $108,000. The next year, if they didn't do it, we'll show them the same thing again. They got their increase, it went to $1.1 million. Their claims were $400,000. Our fixed cost and stop loss premium was $440,000. With their $400,000 in claims, they saved another $268,000. Now this is, obviously we changed the name, but this was a real group. And you can only imagine when we come back the third year to do the renewal, and we're showing them what they would have saved. Usually if they're pretty conservative, which the reason why they might not do it the first or second year, you can imagine they'll do it the third year. So this little history page, if a client's not ready because they're very conservative and they're unsure, you just keep showing we're patient. We'll be around in a couple years. So eventually when you keep showing them how much money they would have saved if they were self-funded, they're going to do it eventually. So this is the kind of things that are going on the marketplace, because for the seminars that we're willing to do for brokers and even your employers, once we get them in a room and show them this before their renewal is the best time to do it. If they're going to learn about a new concept, don't wait till they have 45 days to make a decision on their renewal. Let's get out in front and do some seminars for your brokers or your clients in advance, 6 months or a year in advance. And so they'll understand the concept. So by the time you bring them their renewal and some unique ideas, then they're ready for it. So I know some of the questions are, what do we need to get a quote? Because we're excited about this. It's something different we can bring to our clients. Slide right here is just basic census, which is your date of birth, the genders, and zip codes in which the employees live, and their family status, whether they're individual or parent, child, husband, wife, or family. And then the employer is your SIC code, and basically the plan designs and the effective date. So it's basic information we need to get a quote. The difference might be whether you're a small group that doesn't have any claims experience, so we'll do individual health questionnaires and make sure we get the right rates. Or if you do or have a larger company where you have claims experience, then we can use that to underwrite the group. So really, as far as the two different market sizes, one of the different processes to underwrite is whether you have claims experience or not. This is the website. This is the Habio website that you can go get RFPs and your quotes. And I know this is we're still building this out, but across the top here, you're going to have, your members can come here, employers, partners, which are the brokers, but get a quote. So when you click that, it's just going to be a fillable form to put your data in there and then upload the census. You'll be off and running and filling out your RFP. But you can see it's just a fillable form on the information I was just telling you we need. So you complete this, it's going to go over, and then the RFP process will begin. If we have any questions, we'll reach out to you and make contact with you. But this is your best way to get the process started to get your quotes. Just go right to the website, click on get a quote, and start the RFP process. We're very excited to have the best-in-class partners to bring this product to the marketplace.